The next speaker, where is Dr. Mohamed? Okay. Next speaker is Dr. Mohamed Sayegh. I think all of you know him, so he doesn't need introduction. And he's going to talk about research and how to improve it in the field of organ donation and transplantation in the GCC countries. Please, Mohamed.
I only have few slides, what I call khawatir musafir, and it's just thinking about what is it going to take to make this happen. And I think that it's very important at this stage for the forward thinking related to establishing the principles of research, because if we want to advance this to the level that we want, research has to be an important component. I think there are 4 paths to achieving the goals that we want. First one is we have to define the scientific questions. And we need to define the centers that are capable of conducting the research, because obviously not every center is going to be able to do that. We need to define the players, but we also have to allow open door for new centers and new players in the future, and not appear to be either exclusive or this is a small junta that is trying to control the research in this area. It's very important to have baseline data of research publications, databases, etc. that is occurring, because I don't think everybody knows what everybody else is doing. Although people do have meetings and present their scientific work, I'm talking more of an in-depth review to look at what is out there already, centers, players, what people are doing, and maybe have a retreat or workshop to present and discuss the above. Not in a scientific meeting type presentation, but more of a retreat where people really truly talk about what they have been doing, what they are doing, and try to come up with the questions that we want to answer. And try to put realistic goals and realistic questions that can be achieved in our countries. The second path, once you do this, is the mechanism. I think it's very important after this retreat is to put what we call a request for application or request for proposals for collaborative center grants or for seed grants among individual centers that would like to answer important questions. The reason why to do this RFA or RFP is not to appear that there are few people who are controlling the funding and that it's going to be funneled to certain people, but try to have an objective system of evaluation of proposals. And it also stimulates the community to generate important questions that you may not have thought about. But the most important issue is also define the source of funding for those RFA and RFP. Because without funding, without resources, you cannot do any of those research that you are planning to do. You need to think a little bit, and obviously myself and others can help in the mechanisms of review and awarding these grants for these proposals, and to define the mechanisms to look at progress, productivity, and decide on future support based on the productivity in answering those questions. There is no substitute for a mechanism to try to support this research and not to appear that the money is being funneled to particular centers. The third path, so you define the questions, you define the mechanism of how you're going to do it, is really to put together the infrastructure to do this research. And again, some of this may already be available, but to try to channel it so that it does satisfy where you want to achieve and make it available for the people, because it may be available in one center but not the other. So collaboration is critical, and that's why the center grants should fund collaborative grants. Projects. If the project is not collaborative, it should not really be supported. We have to look at available databases and registries, and there are some, and maybe some of them have to be combined, and some may have to be eliminated. It's very important to obtain clinical epidemiology data and have the infrastructure to do data analysis and biostatistics, publications and communications to the outside world, particularly the public also, who is very important in this issue, and sharing of data and expertise, and not appear to be closed, and this whole issue of ownership of data and things like this have to be worked out. And the last and important path is, what are the challenges when you want to do something like this? This is not a small undertaking, and there are models of how people have done this. I think the CTOT model, the NIH, is an example that we could use to help us navigate through this, but there are also other models. So there are a few challenges when you embark on such a big project. One is funding. Two is funding. Three is funding. It's very important to identify the resources. Even if they are small, it's okay. You pull them, you put them together, you award them to the best proposals. People then get more interested and they provide more support, whether government agencies, pharmaceutical companies, they are there, but we have to really, again, stimulate them to get the funding to be available. Second is governance. There are two things that ruin any project: money and governance. So if you can work out the source of money and define the governance early on, these things will succeed. And I mean by governance is who owns the projects, who can communicate the data, who can publish it, etc. And we are somewhat known in the Arab world to have difficulty defining governance. And people try to fight each other and try to, again, because partly money and partly ego, etc. So working this out very early is very important. And again here, the most important word is collaboration. This cannot be done by one individual or one center. The third thing is the politics of this. And politics, I don't mean the political politics in the sense of governments, but I'm talking about the politics of the centers collaborating together, competitions, egos, etc. And again, early on, and I can tell you, there is nothing better than research that can bring people together. I have worked in a collaborative center. I directed a center at Harvard between surgery, medicine, pediatrics, etc. And the most powerful tool to bring people together is research. Because people can fight about clinical, they can fight about money, about patients, etc. They rarely fight about research. Because research brings dollars and brings collaborations and brings publications. So it's a positive thing. And if you use it right, then you can actually capitalize. People want to identity and get credit. So it's very important, again, when you put together the mechanism of how we're going to do this, is to try to identify mechanisms to allow people, when they present to meetings, when they publish, to get identity, to get credit, but not to the level that it prevents the progress of the research. So when you bring a collaborative group together, you want to make sure that everybody is credited for their efforts. And again, I come back to resources and funding, because if you do not have the resources, all of this is meaningless. Again, even if the resources are initially small, it's okay, because they will grow in the future as you become more productive and as you show that you can indeed do this. People are skeptical that we can indeed put together a research program. And I'm not talking here about one research lab or one clinical trial in one center. I assume what the Faisal and the group have in mind is really a research program that addresses important questions related to organ donation in the GCC. And that can only occur by putting together the efforts of many groups into a collaborative research program. As you can see, I didn't talk about science. This is not a scientific talk. What I try to tell you is what are the mechanisms necessary, the challenges, and how you are going to ultimately do it if you want to set up a research program. It is not easy, it is complicated, but it can be done. And as Thomas Jefferson once said, if you want something you have never had, you must be willing to do something you have never done. But it can be done. Thank you very much.